Welcome to Social Security Disability Help. The URL of our website is socialsecurity-disability.org. Today we will be talking about disabling conditions and how you can gain Social Security disability benefits if you do have a disabling condition. On the top right hand corner of our website, you'll find a Disabling Conditions tab. If you click on that tab, this will lead you to a list of disabling conditions. If you scroll all the way down, one of the disabling conditions listed is organic mental disorders. Today, we will talk about how you can gain disability benefits if you are suffering with an organic mental disorder. Organic mental disorders, also referred to as chronic organic brain syndrome, are afflictions of the brain that can lead to severe mental or behavioral problems. They may be permanent or temporary and can be either hereditary or caused by injury, disease, or structural or systemic defect in body chemistry or hormones. Organic mental disorders do not include disorders that result from substance abuse, nor do they include psychiatric disorders. Common symptoms of organic mental disorders include confusion, memory loss, loss of brain function, and agitation, but symptoms can differ somewhat based on the condition. Examples of common organic mental disorders are delirium, dementia, Alzheimer's, and amnesia. Delirium is an acute onset neuropsychiatric disorder characterized by confusion, incoherent thought and speech, hallucinations, and delusions. Delirium can be caused by intoxication or withdrawal from medication by ingesting a toxic substance, by infection resulting from other medical conditions, or by a combination of factors. The degree of delirium can fluctuate substantially, and a person suffering from delirium may have periods of lucidity. Sleep patterns of affected individuals are often highly disturbed. Unlike dementia, delirium can often be reversed. Dementia is characterized by a gradual loss of brain function and a decline in cognitive or intellectual functioning. People with dementia have symptoms similar to those listed for delirium, as well as changes in personality and disorientation. Not medically considered a disease, dementia is rather identified as a disorder evidenced by a collection of irreversible symptoms. Alzheimer's, the most common form of dementia, is characterized by an increasingly severe loss of cognitive and intellectual functioning, generally over a period of 10 to 15 years. In addition to this loss of function, a person suffering from Alzheimer's disease will develop abnormal tissue and protein deposits in the brain. Amnesia is characterized by partial or total loss of memory, which is not part of delirium or dementia. Long-term memory is usually not as affected as short-term memory. Amnesia can be caused by shock, psychological disturbance, brain injury, or illness. Amnesia can be temporary or permanent depending on the cause. Medical tests used for the diagnosis of organic mental disorders vary depending on the disorder, but may include blood tests, EEGs, or CT or MRI scans of the brain. A physician will also test for underlying causes of the disorder, which might be treated according to the type of illness or injury. Appropriate treatment of organic mental disorders will develop on the specific disorder. But unfortunately, the only treatment of many disorders is limited to supportive care. In the case of delirium and dementia, the person affected may need assistance in most aspects of daily living. Medication can sometimes be prescribed to help control symptoms such as sleeplessness, aggressive behavior, or depression. The Social Security Administration considers organic mental disorders under Section 12.2 of the Blue Book. A related listing, cerebral trauma, traumatic brain injury, is found in Section 11.18. The SSA defines organic mental disorders as psychological or behavioral abnormalities associated with the dysfunction of the brain, and requires that when you apply for disability benefits, you submit records documenting the patient's medical history, including examinations or laboratory tests which demonstrate the presence of specific organic factor judged to be the cause of the person's abnormal mental state and loss of mental function. If you are disabled because of an organic mental disorder so severe that it prevents employment, you may be entitled to Social Security disability benefits. Working closely with the medical professionals and a qualified Social Security disability attorney or advocate to collect and present the appropriate materials to support your disability claim can help to ensure that that your organic mental disability case will have the highest possible chance of success. Thank you for taking the time out of your day to visit our website. If you believe that you are suffering from an organic mental disorder and would like to be contacted by an attorney, please fill out the free evaluation form located on the top right-hand corner of our website. Thank you, and